Thank you, Madam Chairman. When I held my town hall meetings this last break, Bedford, Texas comes to mind. The crowds pretty consistently stood and delivered one message: please simplify the tax code. Please make it to where the IRS does not have as much involvement in our lives. Pretty simple message from my constituents. When I got the briefing paper for this hearing today, which was a very good briefing paper, I was taken back by the exact opposite. When the Affordable Health Care Act comes into effect, the IRS is going to be even more involved in our lives. The IRS is going to be a bigger part of everybody's tax return. And in fact, in my opinion, people that have been doing their own taxes may now have to consult with someone and pay someone to help. And in my mind, we're going exactly the opposite direction. Yes, 33 million people theoretically will have access to health care, but 300 million people are possibly impacted by the process that we've put in place to bring about that change. Mr. Hodge, Deputy Commissioner Miller suggested that the process of taxpayers updating government officials about the details, the intimate details of their personal family lives had really nothing to do with the IRS. It was just going to be a simple calculation, you fill out your return, and based on what you put on the return, that was going to be the extent of the IRS's involvement. Do you have anything to say about that?
Well, it looks very clear, as I understand the legislation, especially from what Mr. Goldberg and Ms. Pickering has said. The IRS will be immediately and very intimately involved in that. And if I read the briefing from the Joint Committee on Taxation summary of the ACA, it says very clearly that any adjustment to tax resulting from the difference between the advanced premium assistance and the allowable refundable tax credit would be assessed as an additional tax or a reduction in tax on the tax return. In many respects, this would be like the alternative minimum tax, where it's sort of an accidental thing that people fall into when they actually fill out their tax return. It's very difficult for them to adjust their withholding in such a manner as to anticipate this situation. So they're going to be caught in this bureaucratic quagmire between HHS and the exchanges, which could make a mistake, and their own changes in their own situation, and then the IRS that has to rectify these. I feel sorry for folks that are going to get caught up in this, and they will end up on April 15th realizing a tax burden that they may not have seen coming. That's pretty frightening.
Mr. Goldberg, do you see, you made the comment earlier that business and individuals are very responsive to the tax code, and they will sit down, they will figure it out. Do you see the opportunities for additional tax avoidance in the way these forms are filled out? Or do you see people's behavior being altered? Do you see them sitting down with their accountant saying, okay, we may have filed this way before, but because of the new rules, we're going to decide to file this way, and in fact, the alternative minimum tax is an excellent example for my district, because that's the #1 thing in the tax code that catches my constituents. Will it alter the behavior of taxpayers?
Yes, sir. I believe that is a certainty. For example, if you have a young kid off on his or her own who's healthy, someone, I guarantee you, will tell her you can either pay $400 to the IRS or you can pay $3,000 to the exchange, or you can wait, and when you get sick, you can buy an insurance policy because there's no pre-existing conditions, so you can save $2,600 a year till you get sick. That is going to happen for sure. So yes, Of course. And I think that that's just human nature. I mean, you see nothing but human nature if you're running the IRS, better and worse. The important point I think that Congress needs to keep in mind is if you say you want to maintain private markets for health insurance, and if you say I want to subsidize the cost of insurance for those who have difficulty paying, you have just said, I want some form of phased-out credit. That's what you just said. Otherwise, you can give everybody $25,000 and tell everybody to go buy insurance and tax it at the back end. That would actually work. But otherwise, you're stuck with this question. I personally think the structure of the Ryan proposal, setting aside the numbers, in many ways is a terrific structure. It was first supported by President Clinton. But it has the same question. How are you going to get progressive, subsidized subsidies from the government to buy health insurance? So you got the same question any way you go. You got the same issues. And I believe the choice is very simple. For all of its problems, you either let the IRS administer those kinds of progressive credits, or you get somebody else to do it. And I think it is a more prudent choice to let the IRS do it. But you can't avoid the choice. You go to single payer, you avoid the choice. But otherwise, I think you're stuck with it. You are absolutely right about the behavior. The tax code today is grotesque. It's repulsive. It is so needlessly complex in terms of issues. Your colleague across the Capitol, Senator Coburn, is a profile in courage for calling out some of the needless subsidies provided by the tax code. You guys could do a terrific job to strip it down. Health care, progressive subsidies, phased out credit, you're stuck where you are, whether it's Congressman Ryan or whether it's the Affordable Care Act. That's what I think.
Thank you, Mr. Goldberg. The time has expired. Thank you, Mr. Marchant.